Hello students, welcome to the lecture on Nutrition, Education of Community, and after this lecture, we will be able to learn the following objectives. Discuss nutrition education, describe role and preparation of ORS, explain nutrition education of members suffering from fever and diarrhea. Let's start with the concept of nutrition education of community. Community education is aimed at human resource development by providing the necessary knowledge of the social and physical environment, by developing capacities and skills towards effective participation in local level problem solving and self-reliance in development activities. People should be given the opportunity to participate in determining their goals and to make decisions for major changes in their communities. Sierra Leone has an infant mortality estimated to be one of the highest in the world. It is estimated at over 200 per 1,000 live births, differing markedly by regions. Respiratory diseases, skin ulcers, health meningitis, infections, anemia, schistosomiasis, and diarrhea also constitute serious health problems. Malnutrition exists in both urban and rural areas. A national survey conducted in 1978 concluded that nearly 24% of all children in the 0 to 5 years of age group suffered from chronic undernourishment. The average daily intake of food necessary in order to lead a healthy life remains far below the required level within the average household. It follows that approximately 30% of the young children are underweight, with the peak being attained in the second year of age. The most important health and nutritional work in the community consists of prevention rather than cure. Children are more vulnerable than adults to the effects of poor nutrition and health condition. Under 5s are at an age when poor nutrition can contribute to serious illnesses. Food habits which contribute to undernutrition food habits are difficult to change. They are deeply rooted in the past for all people and intimately woven in customs, religious beliefs, educational and economics attainments of a given society. The failure to provide enough of the right amounts and kinds of foods to those with greatest nutritional need may be rooted in food habits, traditions, beliefs, and plain ignorance. Nutrition education recognizes that nutritional diseases and poor nutrition status of the people come from 4 factors. Number 1, dietary deficiency. Number 2, ignorance. Number 3, eating habits. And number 4, standard of living. If the principal object of nutrition education is to ensure that each individual eats suitable food to safeguard his health, then the rudiments of nutrition must be taught in as early as primary schooling, and public awareness of nutrition problem must be increased. Its content and materials must be derived from the resources, experience, and needs of the community. The greater the involvement of the community in a planned activity, the more will be its success. Community participation provides unique opportunities for determining real health problems in relation to the physical environment, food production, and the people's nutrition. Nutrition education recognizes that nutritional diseases and poor nutrition status of the people come from 4 factors: dietary deficiency, eating habits, and standard of living. The aims of nutrition education are: in the past, nutritional advice was not always practical or appropriate for the people, since the messages were decided by nutritionists or health experts of government offices rather than worked out in association with the local community. Developing together with the community's effective educational strategies and communication channels in order to plan adequate messages on nutrition. Training local key person, health workers, agricultural extensionists, and other community or projects workers for further promotion of the messages. Reaching men and women as receptors of nutritional messages, women by themselves often cannot remove the causes of nutritional problems. Knowing which sort of problems it might solve and how to use resources in the most efficient way, helping people to develop new attitudes and confidence that they need to improve their nutritional habits and how to feed to their families. Nutrition education involves learning new information on nutrition and its relationship and influence on other sectors such as agriculture, health, or environment. Let us now understand the role and preparation of ORS. Diarrhea and dehydration is one of the most common childhood complaints. In addition, when people perform heavy exercise without adequate hydration, they also run the risk of dehydration. The classic approach to dehydration among the medical profession is to put up in 4-line and replace the fluids. There are, however, disadvantages to the use of 4 rehydration. Firstly, there is the issue of expertise. Putting up a drip in a severely dehydrated person can be difficult, and this is exacerbated in children who have a lower blood volume to begin with. For people without practice in putting up lines, it can be just about impossible. Coupled to this is the risk of infection with 4-line. Good 4 technique reduces the risk of an infection to the site, but poor technique or unhygienic condition can lead to an infection that may be difficult to treat in an elderly, unwell person. The third and possibly most important problem is cost. The 4 lines are not cheap, particularly when hospitals and medical suppliers are non-operational or out of stock. 4s are a scarce resource and can only be used for life or death situation. If an isolated retreat community has a limited stock of 4 tubes and bags and no means of resupply, then the use of this equipment must be restricted to cases where there is no other option. Oral rehydration can be a highly effective, inexpensive and uncomplicated treatment for most forms of dehydration. It requires no specialized skills or equipment, uses ingredients that are ubiquitous and have a long shelf life, and has a very low risk of complication. Indication for use of oral rehydration. Oral rehydration solution can be used to treat most forms of dehydration and hypovolemia. It relies on the gastrointestinal solution for absorption and so is not helpful in condition where the GIT is non-functional for some reason. In these circumstances, 4 rehydration may be the only option. For the majority of conditions where fluid loss occur, such as diarrhea, vomiting, excessive sweating, or inadequate fluid intake or blood loss, oral rehydration can replenish the body's fluids adequately. While ORS is not a substitute for blood or other 4 blood replacement media, it can exist in replacing lost volume. When a person loses a large volume of blood, there are 2 separate factors that cause symptoms. Firstly, the loss of red blood corpuscles, RBCs, reduces the oxygen carrying capacity of blood. Oxygen is held in the RBCs, and the reduction in the quantity of these cells reduces the ability of the circulatory system to transport oxygen to the cell. Secondly, the loss of fluid volume leads to a reduction in the volume of blood circulating around the body. This reduces the blood pressure and makes it more difficult for the heart to circulate an adequate volume of blood to the tissues. In dehydration, other than caused by blood loss, the issue is generally the loss of water. This leads to a lowering of the volume of the blood. Without lowering, the number of RBCs is in the blood. This causes the blood to become more viscous. As a result, the heart has to work harder to pump a smaller quantity of more viscous blood around the body. In blood loss, this will increase the available blood volume but not the oxygen carrying capacity. This can still help if it stabilizes the blood pressure and makes it easier for the heart to transport the remaining RBCs around the body. In other forms of dehydration, the replacement of fluid volume will reverse the major symptoms of dehydration and enable the person to recover. Why not just water? Plain old water is a good agent to prevent dehydration. Dehydration is a loss of water, so in order to reverse this, water should be added. The complication of this is that water is not actively absorbed from the gut. Water flows by osmosis into the cells lining the gut, and this can take a while. If someone is dehydrated, we want to restore the lost fluids as soon as possible. The reason for this composition are as follows. Sodium is rapidly absorbed from the gut. Glucose, which is what sucrose is broken down to, is linked to sodium absorption. This is why ORS is superior to sugar water or plain water for rehydration. The salt speeds up the absorption of glucose, and the glucose speeds up the absorption of the water. This puts a lot more water into the body quickly. A brief word about sports drinks. Many sport drinks advertise themselves as being isotonic. This means that they have the same concentration as body fluids under normal circumstances. In many cases, this is an out-and-out lie. The concentration of a number of commercial solutions is far higher than the normal body osmolarity of 290 to 300 mmol. The other fact to be borne in mind is that the other solutions that do have the right concentration have very little salt. This is because salt interferes with the taste, and sweet solutions are more palatable. As any marketer knows, if they do not like the taste, they will not buy it, no matter how good it is. The other important aspect to note with ORS is that it is optimized for putting water back into the body. In acute dehydration, water is the most important constituent to be lost, and replacing it will resolve the patient's symptoms. In contrast, chronic diarrhea or vomiting, or other words of fluid loss, will result in electrolytes such as potassium being depleted. This can lead to serious symptoms, and in order to prevent this occurring and to find the cause of the chronic illness, a medical professional should be consulted. The vast majority of short-term diarrhea or vomiting episodes resolve themselves rapidly, needing only supportive ORS. Diarrhea that lasts for more than a week or has other complicating symptoms should be referred for treatment. Making ORS. ORS is an incredibly simple recipe. 8 teaspoons of sugar or glucose powder, half teaspoon of salt, 1 liter of water. Instruction: mix and drink. The ORS can also be made up according to whatever units, bottle size or quantity is convenient for you. As you can see, it is cheap and uses ingredients that are almost always available. One will see why most commercial soft drinks use minimal salt. Salt does not make it taste good. However, just by adding a little salt, you greatly increase the speed with which the solution is absorbed. One can add a cup of orange juice or a banana mashed up with you like to the ORS to give it more flavor and make it palatable. Giving ORS. The ORS is very commonly recommended for children with diarrhea and pregnant women with morning sickness. It is always appropriate for other people with moderate dehydration. Severe rehydration is generally treated with 4 fluids because of the need to get fluids in rapidly. The ORS can be given in whatever quantities the child is willing to take. It can also be given to a baby in a bottle. Care should be taken to ensure that the bottle is clean and the water boiled or treated, as diarrhea is often caused by contaminated food or bottles. The ORS is safe if given in excess, except in the case of heart failure or kidney failure, as any excess fluids given will simply be urinated out. As a result, it is generally best to give as much as a child will take, especially if you do not have a higher level of medical care available to treat the child. The ORS should be given when babies or small children develop diarrhea. It is given in addition to normal feeding, as the child still needs the milk or food for normal body growth. The ORS helps to replace the increased fluid loss due to the diarrhea. The ORS should be given after each bout of diarrhea, as this will assist in replacing the lost fluids. Anti-diarrhea medication should be avoided in the majority of cases of diarrhea where there is no blood in the stool, as diarrhea is often the body's way of eliminating irritants or getting rid of contaminated food. Adults are more able to regulate their own intake of ORS. In most cases, dehydration can be avoided simply by matching fluid loss with fluid intake. If, however, dehydration does occur, ORS can be useful to rapidly rehydrate them, and they can then be maintained by drinking more palatable substances such as juices. A patient who is severely dehydrated enough to be only partially conscious should receive 4 fluids, as they are both in severe need of fluids and may be unable to control their own airway and hence may breathe in ORS by mistake. Causes of diarrhea. Diarrhea, frequent runny or watery bowel movements, pooped, is usually brought on by gastrointestinal (GI) infection caused by viruses, bacteria, or parasite. The specific germs that cause diarrhea can vary among geographic regions depending on their life or sanitation, economic development, and hygiene. In developed countries, including the United States, diarrhea outbreaks are more often linked to contaminated water supplies, person-to-person contact in places such as child care centers, or food poisoning when people get sick from improperly processed or preserved foods contaminated with bacteria. Most cases can be spread to others for as long as someone has diarrhea, and some infection can be contagious even longer. Diarrhea infections can be spread through dirty hands, contaminated food or water, some pets, direct contact with fecal matter, that is from dirty diapers or the toilet. Anything that the infectious germs come in contact with can become contaminated. This includes toys, changing tables, surfaces in restrooms, even the hands of someone preparing food. Kids can become infected by touching a contaminated surface, such as a toilet or toy, and then putting their fingers in their mouths. Rotavirus infection is a frequent cause of viral gastroenteritis in kids. Rotavirus usually causes explosive, watery diarrhea, although not all will show symptoms. Rotavirus has commonly caused outbreaks of diarrhea during the winter and early spring months, especially in child care centers and children's hospitals. However, a vaccine now recommended for infants has been found to prevent approximately 75% of cases of rotavirus infection and 98% of the severe cases that require hospitalization.
How to treat diarrhea. Symptoms of diarrhea include frequent loose stools, abdominal cramps, and dehydration, all of which are uncomfortable for you or your children. Because diarrhea is usually not a serious illness, it can easily be treated at home. You will need fluids, clean hands, and a doctor. Step 1. Treat your child's diarrhea at home by increasing fluids that help replace electrolytes, like sports drinks. For babies, offer them additional breast milk or formula. Avoid plain water, fruit juice, and sodas. Step 2. Continue your child on their regular diet. Step 3. Frequently wash your hands and your child's hands. Keep suspected diarrhea-contaminated areas clean. Step 4. Consult a doctor if your child's symptoms do not improve within 24 hours. Call a doctor if your baby has not had a wet diaper in over 3 hours, has a fever higher than 102 degrees Fahrenheit, is unusually sleepy, has a dry mouth, or has bloody or black stools. Step 5. Treat diarrhea in adults by drinking plenty of clear fluids such as water, broths, and gelatins. Avoid coffee, alcohol, and apple and pear juices. Step 6. Gradually add solid and low-fiber foods such as soda crackers, toast, and chicken. Avoid dairy products, high fiber, and fatty foods. Step 7. Consult a doctor if you are an adult and the diarrhea lasts longer than 3 days, you are dehydrated and have had severe rectal or abdominal pain, bloody or black stools, or a temperature above 102 degrees Fahrenheit. Eating the right things, or getting the right advice from the doctor, will have you back to your regular self in no time. Did you know? Acute diarrhea is commonly caused by consuming food or water contaminated with a viral infection, bacteria, or parasite.
Now we will discuss the nutrition education of members suffering from fever and diarrhea. The role of a well-educated populace continues to be a common research subject within the social sciences. In terms of economics, political science, and sociology, increases in education have been shown to bolster economic development and politically mobilize the public. From the early period to the current educational system, the mindset has been imbued with the belief that education and examination preparation represent the potential for social access and status selection. Focusing only upon the post-independence period, Said meticulously outlines the tumultuous debate concerning the educational system. Two issues, whether to maintain the multi-track elitist system and whether or not to decentralize educational authority, were discussed among pro-American and or nationalist education organizations. The division between liberal and conservative pedagogues were not always distinct, given that all educators emphasized the moral component of education and viewed education as a means to produce a prosperous and strong nation. The aggregate costs of college examination preparation were astronomical, particularly in the form of private tutoring. To counteract the overarching impacts of the examination, the state began to control the college entrance system by instituting a new college entrance achievement test and requiring that a student's high school grade point average represent 30% of the basic for college entrance. First of all, it should have employed the comparative method of analysis more often to highlight the distinctiveness, but it does, such as in comparison of the Parent-Teacher Association (PTA) and its American counterpart, deep insight into the nature of the transfer of Western ideals is offered. Secondly, the plausibility of correlating institutional factors and developing are too open-ended. The greatest shortcoming of education fever is the absence of a methodological discussion of the terms democratic education and American educational theory. The two are used in conjunction and at times interchangeably. An explanation of what means by democracy at the outside would have yielded greater clarity for argument. Irrespective of these points, education fever presents a critical and complex set of issues in history with real work. This is particularly useful for its integrated presentation of development, and in this respect has the potential to attract not only historians but also audiences from education, economics, political science, and sociology. Scholars of education, for example, may focus upon the function of foreign universities in the education system. Sociologists and political scientists can consider the cyclic nature of students' movements and the function of education in the political transition, and economists may dwell on attempts to bolster its research and development sectors. Whatever the case, findings are genuinely captivating and prompt careful reflection for studies specialists as well as the casual observer. Diarrhea in children. Diarrhea in children and babies is a passage of loose stools. Recommendation: diarrhea has many causes including antibiotics, consuming too much fruit or fruit juice, food sensitivity, illness, infection. Diet. What the child eats or drinks may make diarrhea worse. Changing the diet may relieve some types of diarrhea. In most cases, one should continue feeding the baby or child as usual. Most children can keep up with the nutrients they lose through diarrhea if they increase the amount of food they take in. For babies, always continue breastfeeding or formula feeding. Many children develop mild and temporary lactose intolerance. Continuing dairy foods may make the diarrhea last longer, but it can also allow a faster return to a regular diet. Babies who eat solid foods may continue to do so as long as they can keep the food down. For some children, a return to their regular diet can also bring a return of diarrhea. This is usually due to mild difficulty the gut has in absorbing regular food. This type of diarrhea usually does not last long and is different from the diarrhea that came during the actual illness. It requires no treatment as long as there are no other symptoms. Diarrhea caused by antibiotics may be reduced by giving the child yogurt with live active cultures. Look for a statement on the label. If the diarrhea persists, contact healthcare provider to discuss changing or stopping the antibiotic. Do not stop antibiotic treatment without checking with child's doctor. Fluids. Fluid is very important because it is easy for a child with diarrhea to become dehydrated. Dehydration is a serious condition in babies and young children. Lost fluids need to be replaced. Replace fluids rehydration through drinking for all, but the most seriously dehydrated children or those who cannot keep fluids down. For most children, any fluid that normally drink should be enough. Too much water alone at any age can be harmful because water does not have any sugars or important electrolytes such as sodium. Rehydration solution include rehydrolyte and the World Health Organization oral rehydration solution. Other products such as Pedialyte and Infalite may help keep a child properly hydrated and prevent dehydration. Some of these solutions are available at the supermarket or pharmacy and do not need a prescription. However, you should consult your doctor before using them in infants. Popsicles or gel can be excellent sources of clear fluids, especially if the child is vomiting. One gets large amounts of fluids into the child slowly this way and avoid overfilling the stomach. This is especially important if the stomach is already irritated by an infection. For most children, drinking more fluids is enough, but occasionally it is necessary to give fluids through a vein. Fluids given by for correct dehydration are faster than those given by mouth. Contact healthcare provider if child is much less active than normal, not sitting up at all or looking around. Diarrhea contains blood or mucus. Diarrhea develops within 1 week of travel outside of the United States or after a campaign trip. The diarrhea may be due to bacteria or parasites that require treatment. Diarrhea is accompanied by multiple vomiting episodes, fever or abdominal cramping. Diarrhea is severe or lasts longer than 2 to 3 days. Diarrhea keeps returning or the child is losing weight. The child has signs of dehydration, called immediately. Dry and sticky mouth, has not urinated for 6 hours, no tears when crying, sunken eyes. The doctor may prescribe medication to help control the diarrhea. Call the doctor before using over-the-counter medication for diarrhea because they may be either ineffective or potentially dangerous. Now in the end, let us summarize what we have learned in this lecture. Community education is aimed at human resource development by providing the necessary knowledge of the social and physical environment by developing capacities and skills towards effective participation in local level problem solving and self-reliance in development activities. Sierra Leone has an infant mortality estimated to be one of the highest in the world. It is estimated at over 200 per 1,000 lives birth, differing markedly by region. The most important health and nutritional work in the community consists of prevention rather than cure. Children are more vulnerable than adults to the effects of poor nutrition and health condition. Under 5s are at an age when poor nutrition can contribute to serious illnesses. Diarrhea and dehydration is one of the most common childhood complaints. In addition, when people perform heavy exercise without adequate hydration, they also run the risk of dehydration. The classic approach to dehydration among the medical profession is to put up and four line and replace the fluids. There are, however, disadvantages to the use of for rehydration. Firstly, there is the issue of expertise. Putting up a drip in a severely dehydrated person can be difficult, and this is exacerbated in children who have a lower blood volume to begin with. For people without practice in putting up lines, it can be just about impossible. Coupled to this is the risk of infection with an four line. Good four technique reduces the risk of an infection to the site, but poor technique or unhygienic condition can lead to an infection that may be difficult to treat in an ordinary unwell person. The role of a well-educated populace continues to be a common research subject within the social sciences. In terms of economics, political science and sociology, increases in education have been shown to bolster economic development and politically mobilize the public.